pronounced Sjögren's syndrome. It's kind of an interesting spelling, but okay, so what it is a autoimmune disorder that is characterized by two common symptoms of dry eyes and a dry mouth. So what happens is the body attacks the glands that make tears and saliva, which causes dry eyes and dry mouth. And the condition often accompanies other immune disorders that are rheumatoid arthritis and lupus. And usually the first thing that's affected by the disorder is the mucous membranes and moisture secreting glands of the eyes and mouth. And that's just a picture of where the salivary glands are. So some of the symptoms, the eyes may look dry and feel itchy, almost like there's sand in your eyes. And then mouth is also, like, as you can see, like there's a picture of the tongue, it looks like it has cotton in it, and yeah, it is kind of interesting. And then joint pain and swelling and stiffness, and swollen salivary glands, and then skin rash, dry skin, and a persistent dry cough. And then diagnosis, what will happen is they'll perform a blood test on the patient, and they'll test the antibodies, inflammation, and check for liver and kidney problems. And the Sjögren test, which they use filter paper to measure tear production to show how the glands are being affected by the disorder. And then they'll do a silogram, which is an x-ray that detects, and then dye is injected into salivary glands to show how much saliva is flowing into your mouth. And then salivary scintigraphy, which injects a radioactive isotope into the vein, and it's tracked for an hour to see how quickly it reaches the salivary glands. And then a lip biopsy, which just checks for inflammation. Causes and risk factors. So certain genes put people at higher risk for this disorder, and your immune system targets the glands that make tears and saliva as well as other parts of your body. So typically, if you're over 40 or a women are more likely to have this disorder than men. And then if you have rheumatoid arthritis or lupus, and lupus is also an autoimmune disorder, it's just attacks tissues and organs and different body systems. And different types of treatment. There is no cure for Sjögren syndrome, but medications can be taken to decrease inflammation in the eyes and increase production of saliva. And it also helps with other infections. And surgery can be done to seal the tear ducts and drain tears from the eyes. And then things that you can do at home is use artificial tears, eye lubricants, and increase humidity, stop smoking, and lots of other things. And then the prognosis and follow-up. So most of the time they'll just instruct the patients to stay connected with the doctor and have regular appointments to check how things are doing. And then most people can live a normal life even though there's not a cure for this disease. And the doctors will recommend a high calorie diet, protein rich, and especially for patients that have mouth regions. And they'll inform patients to avoid tobacco, alcohol, and smoking. And they'll also instruct them to avoid sugary foods and salty foods and high acid